We've talked about blood pressure, which is the force of the heart pushing blood through the arteries. By the time the blood flows through the arteries, then through the capillaries, and gets into the veins, pressure is very low. Also, veins do not have a pulse. So when it comes to blood flow in the veins, the heart really isn't doing much. You do not have enough pressure from the heart to push blood through the veins. So you have to rely on other methods to help get the blood through your veins back to your heart. So we have two methods we're going to look at here. One of these methods is the skeletal muscle pump. You can see here are your muscles. And when your muscles are active, they squeeze a vein. So in this picture, you can see a vein being squeezed between two muscles. It's kind of like squeezing a tube of toothpaste. When the muscles squeeze the veins, they force that blood to move. Notice also that the veins have valves. These valves are similar to the semilunar valves in the heart. They only open upward or toward the heart. They won't open the other direction. So when the muscles squeeze the veins, this pushes the blood, and the valves will only open toward the heart. So the blood has to move this direction. It can move up through the open valves. It can't move back down because the valves won't open that way. The other method that we have is the respiratory pump. This is from your breathing. Here is the diaphragm. You can see it in both pictures. And here in the teal, you can see the chest cavity. Okay, the picture on the left, she is inhaling. And in the picture on the right, she is exhaling. Okay, so look at the differences. When you inhale, two things happen. The diaphragm goes down. Okay, you can see on the left that the diaphragm is lower and it's flat. On the right, it's domed up and it's higher. The diaphragm going down like that pushes on your abdomen. And it has the effect of squeezing the veins. This puts pressure on the veins and squeezes them. So it's similar to the skeletal muscle pump. You're squeezing the veins. The other thing that happens with the respiratory pump is the size of the chest cavity. If you compare the size of the chest cavity here during inhaling to here during exhaling, it's bigger when you inhale. If a cavity is bigger, it creates suction. Kind of like when you drink through a straw, you're creating suction. Every time your chest cavity is bigger during inhaling, you create suction. This suction helps to pull blood to the heart. So you're moving blood through your veins because out in your body you have skeletal muscles squeezing those veins, pushing the blood back toward the heart through the one-way valves. In your torso, you have your diaphragm going down every time you exhale, squeezing your abdomen, pushing that blood through the veins, and you have your chest getting bigger, which creates suction and pulls that blood into the heart. This goes along with your activity level. Think about what you learned back in chapter 19 with increased venous return. When you are active, your muscles are working more. And you breathe deeper. This means that your skeletal muscle pump and your respiratory pump are going to send more blood to your heart. This means you have an increased venous return. You're putting more blood into the heart while it's in diastole and refilling. So think about what you learned in the last chapter. An increased venous return gives for an increased cardiac output. You also, because of the increased venous return, stretch the heart. And when you stretch the heart, you activate that Frank-Starling law, which means the heart's going to contract with more force. Just like when you pull the rubber band and you let it go, it springs back with more force. So now, because of the increased venous return and the Frank-Starling law, you increase your cardiac output. So you already know that when you're active, your heart is beating faster and harder. You have higher cardiac output when you're active. This just shows how those go along. We're tying these ideas together. When you're active, these two pumps work more and help to increase that cardiac output. Okay, now we can look at some problems that you can get in your veins. First, let's look at a nice healthy vein. So on the left here, you have a healthy vein. Okay, you can see that the blood flows up, the valves open here, and they let the blood flow up. Then the valves close behind the blood, and the blood can't go back down. Okay, now let's compare that to the diseased vein on the right. In this vein, notice that it is wider. See how the healthy vein is nice and narrow? The diseased vein is very wide. This typically happens in your legs. This is a varicose vein. You typically get varicose veins in your legs. So let's think about what's happening there. Sometimes people tend to cross their legs. Or you might sit in a chair with your legs pressed against the edge of the chair. Some people have jobs where they have to stand for long periods of time. Okay, any of these things are going to cause blood to build up in your veins. If you're crossing your legs or pressing your legs against the edge of a chair, you're physically collapsing that vein so that blood can't get through. If you're standing for a long time, then gravity is keeping blood down in the legs. Now, if you're standing and moving around, you're going to be fine because the skeletal muscle pump is going to work and push that blood up. But if you're just standing still, the skeletal muscle pump is not going to push the blood. Gravity is going to keep the blood there. So the result of these things is that you get blood buildup in your leg veins. This stretches your veins out. Okay, now look at the valve. The two flaps of the valve are too far apart that they don't meet. Notice a closed valve, the two flaps kind of hold each other up. If the vein is stretched out, the two flaps don't meet and they can't hold each other up. So now the valve can't close. You can't keep blood moving toward the heart. So now, because you've stretched out the vein, blood builds up even more. And this is how you get varicose veins. So there's a lot of factors that go into it, genetics and weight and other things, but you do have some control. If you want to avoid varicose veins, you can make sure that you don't stand still for long periods of time. You can wear compression socks. Those help support your veins. And you can make sure you don't cross your legs or sit with your leg pressed against the edge of a chair. Another problem that you can get is a deep vein thrombosis. So this is when you get a blood clot that you don't want. So in this case, we are dealing with a blood clot. That's what a thrombosis is. Okay, this tends to happen if you are inactive. Okay, such as recovering from surgery, or if you're traveling and so you're sitting in a car, sitting in an airplane for a long period of time. When you're inactive, your skeletal muscle pump and respiratory pumps are not doing much. So you tend to get a lack of blood flow in the veins. The blood can actually become stagnant in the veins. And this is especially true in the legs. This typically happens in the legs. Okay, being dehydrated is another problem. If you are dehydrated, you don't have enough water in your blood, so the blood is going to be thick. So, being inactive and having dehydrated, thick blood increases the chances that your platelets will start to clump together. And if this happens, you can form a clot in your vein. This can then lead to another problem of an embolus. So you can see here where it says embolus. Here's your clot in your vein. Here's an embolus. An embolus is when all or part of that clot breaks free. Okay, this can then cause other problems. If we look here at this picture that gives us an overall of the blood flow in the body, a deep vein thrombosis will typically form about here in a leg vein. Okay, then if that clot forms and becomes an embolus, so it's flowing, well, it's in a vein, so it's going to flow back toward the heart. If you think about the systemic veins, they start off really small. So a systemic vein that's out in your body is going to be small and narrow. As veins get closer to the heart, they merge together to make bigger veins. So as you get closer to the heart, the diameter gets wider. So now you can see here, it's very wide as we get close to the heart. The embolus can't be any bigger than the vein it formed in. So the embolus is going to have a maximum size of the vein it formed in. Which is typically going to be more narrow. So now, as we get here to the heart, you have this embolus. It has plenty of room to move, so it's not going to get stuck. Think about your path of blood. We're going to go into the right atrium. The chambers of the heart are definitely bigger than your veins. So again, the embolus has plenty of room. It's probably not going to get stuck. It's going to go into the right ventricle, which will then pump it into the pulmonary trunk. And from the pulmonary trunk, it's going to go into the pulmonary artery. Now the vein is in a pulmonary artery heading toward the lungs. Now the embolus is in a pulmonary artery heading toward the lungs. So it will move through the veins and the heart, and then it will be pumped into the pulmonary trunk, to the pulmonary artery. Okay, arteries branch out as you move away from the heart. Here you can see the pulmonary artery branching out. And as they branch, they get smaller. So as this embolus is moving into the lungs, it gets into these smaller arteries, and now it's going to find a place where it gets stuck. This is now a pulmonary embolism. And this is very dangerous because it can block blood flow through the lungs. So you start off with a clot forming in your leg because you're inactive, you're dehydrated, you might be traveling or recovering from surgery. All or part of that clot breaks loose. It becomes an embolus. The embolus travels through your veins, which get wider as they go to the heart. It travels through the heart. Then it travels through a pulmonary artery out to the lungs. Now the artery is branching and getting smaller. It gets stuck in one of those arteries of the lungs and blocks the blood flow. Now we can look at a video that was taken in an operating room of some surgeons removing a pulmonary embolus.
This is a case of an acute pulmonary embolism from a deep vein thrombosis. Here we're performing a pulmonary thromboembolectomy. Here we've established the patient on cardiopulmonary bypass. A arterial line is placed in the right superior pulmonary vein as seen here. This is wide off of the arterial cannula and clamped. As you can see, the clamp is in place. We are on full cardiopulmonary bypass support. The next step is to apply the aortic cross clamp and achieve cardiac arrest. Here we're performing the pulmonary arteriotomy with a knife and then scissors, and you can already get a glimpse of the thrombus inside the main pulmonary artery. As it branches, you can see a grasper is used to remove the thrombus. This is a very large saddle embolus that originated likely from the patient's femoral and iliac vein. She had a fracture of her right lower extremity. It was in a cast, and this was a likely source from the right leg. You can see the embolus is removed. A Fogarty catheter is used to clear any further clots, which none are found. Then at this point in time, we take the clamp off of the right superior pulmonary vein cannula. This allows us to perform retrograde pulmonary perfusion. It goes from the pulmonary veins back through the lungs and out the pulmonary artery, as you can see here. Small emboli and air are cleared, you can see in this portion of the video. Once we're satisfied that the pulmonary arteries have been cleared of debris, and we ventilate as well during this process, once we're satisfied with that, we'll stop the retrograde pulmonary vein perfusion. We'll inspect with the thoracoscope. You can see here the small branches of the pulmonary veins are cleared. The main trunk of the pulmonary artery is also clear, and we inspect the thrombus one more time. You can see this is a very well formed thrombus that is soft, and that ends the case. The patient has done very well following the surgery, and we anticipate a full recovery.